Hello, 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 everyone. Thank you so much for joining me. So sorry that I was a little late today, but I was trying to get everything set up and ready and hopefully get the kids situated such that they won't be banging on the door. One day, I think I'm just going to go ahead and bring the kids in since they like to see what mommy's doing in here anyway. I am Dr. Brandi B, and I am going to talk a little bit today about our Focus on It Fridays. I will give people a few minutes to join us, but while you're waiting, go ahead and like this post and share it with others. Hello, Auntie Louise and Miss Luella. Thank you all for joining me today. Sorry, I'm a little bit late getting started, but I am going to make sure that we get everything discussed that we need to have discussed. We're going to be talking about depression today. Something that all of us, whether it's what people call clinical depression or not, have experienced. We've all experienced depression. We've all gotten sad. We've all experienced death. We've all experienced loss. And so this is a good time to come together and talk about it. Everybody's talking about anxiety, but nobody really wants to say the D word. And so I want us to talk about it, what it is, what it isn't. Thanks, Cousin Latina, for watching. Please share and tell your friends that they need to be coming on over to Dr. Brandi B and watching us on Fridays at noon Central Standard Time. Hello, Miss Keenan, and thank you for watching as well. Glad you all could make it. We're going to give everybody just a few more minutes, maybe one more minute, and then we will get started. I do appreciate y'all for coming to join us, and I will be here every week at noon Central Standard Time. Hello, Mommy. So even if I don't tell you what we're talking about, unless I say we're not talking, we're talking, because I want to talk to you all, because you all apparently are listening. Either you like me or and you're being nice, or this is some good information. Hi, Auntie Brenda. Thanks for joining us today. One more minute. We'll start at 12:10, and we're going to have a good conversation today. If y'all have any questions, go ahead and drop them in the chat. I certainly don't mind answering them as I go. Hi, Rachel. How are you? I certainly don't have a problem answering your questions as we go today, but if I miss them because I'm talking and I just don't see it, I'll come back and answer it in the chat. Thank you all so much for joining me today. I'm in a little bit of a different attire today, and I'll even explain that. It's kind of how I decided what we would talk about today. All right, so it's 12:10, so we will go ahead and get started so I can respect your time. Again, I'm Dr. Brandi B, your triple board certified pediatrician, adult psychiatrist, and child and adolescent psychiatrist. I help worried, overworked, overwhelmed, and plain old tired moms who have children with ADHD and several other mental health disorders work with their children and become knowledgeable about their children's disorders so that they can help them to behave, be well, be seated, and be successful in the classroom and in life. Obviously, you're here today and we're talking about depression, so given that I am board certified in 3 specialties, I certainly have the ability to talk about all of them. And we'll throw in some pediatrics here at some point. I talked a little bit about firework safety, and that actually was a little bit more about pediatrics than it was about anything to do with mental health, but it's all important and it all comes together. Today we're going to talk about depression. What do you do when you just can't be happy? I'm sure that many of you all have heard people say, well, they just need to get over it. They just need to be happy. That happened to them 20 years ago. Their daddy is dead now. That husband is with a new wife and cheating on her too. I know y'all have seen that. And if I were live with you today, I'd say, hey, show me your hands. And everybody's hand would go up because we've all been in some situation that caused us to be sad. Now, I'm a real upfront type of doctor. I believe that if we aren't calling things what they are, then we can't appropriately address them. So if we aren't saying sad, if we aren't saying depressed, we can't appropriately address it. Saying down is even acceptable, but we need to make sure that we are using terms that not only help it to be a normalized thing because everybody gets sad, but it will help others to know what we're saying. She's just a little bit torn up. Well, I don't really know what that means. Did her knee get torn up? Because that's my frame of reference. And in my family, people have bad knees. So is her knee torn up? What are we talking about? What is torn up? So let's just go ahead and call it what it is so we can better deal with it and accept that it is what it is. 3 things I want to talk about today. I tend to hold y'all too long, and so I'm going to try not to do that. I'm going to try to stick with 20 minutes today. But 3 things we want to talk about today regarding depression. We want to talk about the fact that depression is real. Okay, so don't ever let anybody convince you that what you're feeling is not real. And don't ever let yourself convince yourself that what you're feeling is not real. We want to talk about the fact that depression is treatable. And then we want to talk about the fact that depression does not look like what you may think it looks like. And that was a lesson that I had to learn even as early or as late as a year ago. Hi, Auntie Rosalind. Thank you for watching. Go ahead and share with others. Tell everybody that we're over here having a lot of fun Fridays at noon, Central Standard Time. One of my girlfriends got on to me. She said, girl, you are international. People are watching you everywhere. They need to know the time zone. So thank you, Taria, for reminding me about that. All right, so let's talk about depression. It's real. What is it? All right. So depression, in order to have a diagnosis of depression, you must either have low mood or irritability. Now, some people may say, well, I'm not depressed, but everybody around them is thinking, well, if I speak to you, you bite my head off. That is an example of irritability. Some people, depending upon where you are, where you live, you may call it ill and say that people are just ill all the time. Another way that people call it is, they don't say irritable, they say irate is one word. I'm not thinking of what a lot of my patients will say to me, but it means irritable. You're snappy. You're just biting people's heads off. And it's because there is that disturbance. You just can't get your mind quite wrapped around the fact that the way you hopefully had been in the past as far as your mood, you don't have that anymore. So you have to be either able to express low mood or to express the fact that you're irritable. And most people recognize when they're irritable, even if they don't recognize when their mood is low, because nobody wants to say the D word, right? Or the S word, and that's depressed or sad. All right. So in children and sometimes in other people, folks around you may be able to say, well, she doesn't see it, but we do. Hello, doctor, we do. All right. Hi, Auntie Patrice. Thank you for joining all the way from Florida. Thank you. Please tell your friends and share this post so that your friends can come on and join us. All right. So you have to either have low mood or irritability that you notice, or sometimes that other people around you notice as well. In addition to the low mood or irritability, you also have to have 4 other symptoms. 4 other symptoms of what I'm about to go through now. And that can be interest. You lose interest in those things that you used to do. So if like my friends ever come upon me and I said, well, girl, I just don't feel like shopping. Now, I have not been shopping since COVID, so yes, I've not been to the mall. But if there is no COVID, and one day there won't be, and life is good, and all of a sudden for weeks on end, I don't want to go to the mall, check on me. I'm not okay. I don't care what I tell you. I am not okay. And you have those 1 or 2 friends who know when you're okay. If you like to knit and suddenly you don't like to knit. If you like sitting on the porch and suddenly you don't like to sit on the porch. If you like drinking coffee and suddenly someone died and now you don't drink coffee. That is just but one thing that we need to consider among the others that I'm going to mention, okay? So losing interest. A big word for that is that we call it anhedonia. Anhedonia, which means you lose interest in things that you would ordinarily do. All right. So you're feeling guilty. That's another thing. That wouldn't have happened if it wasn't for me. I see that a lot in children of divorce. They believe that parents wouldn't have gotten divorced if it were not for their blank, their ADHD. They're not doing well in school. They're being sick. They're being born. And so they feel guilty about that, okay? Some people also feel hopeless or worthless. Worthless is I can never do anything right. I'm no good. I'm not as good as other people. Those are symptoms or statements that would signify that a person is feeling worthless. And then feelings of hopelessness. Things will never get better. Nothing will ever change. It will always be this way. If anyone expresses to me statements that seem like hopeless statements, I am very, very, very concerned, because as long as there is just a glimpse of hope, that gives you courage, the strength, and the ability to keep going. So whenever I call someone and they're sick and they say, well, I've got this going on, this going on, this going on, this going on, but I'm going to just hang on in there, I'm like, thank you, Jesus, because they added that last part, because otherwise it sounds like nothing is going good for them. Jesse Jackson says, just keep hope alive. And we know that if there is just a little bit of hope, you can keep going. All right. So we've got sad mood or irritability, plus you need 4 of the other things. You can either have loss of interest, or you can have feelings of guilt or feeling worthless. All right. That's just 2. All right. So your energy. Have you ever noticed that when you are sad, depressed, that you just want to get in the bed? You have no energy. There's a term we use called laden limbs, Leaden. It means that your limbs feel like lead. You just can't get going. You're dragging. You're in the bed. Hi, Stacy. Thanks for joining. Hi, Kima. Thanks for joining. Go ahead and share with everyone and let them know that we're here and we're learning about depression today. All right, so that low energy, that's a part of depression. Depression hurts is what people say. And sometimes in addition to their limbs feeling heavy and laden, Leaden, like lead, Lead, you will hurt. You're just in pain because depression hurts, right? All right, so that's going to be another thing that we're going to watch out for. Decrease in interest, the guilt, the feelings of hopelessness and worthlessness, and your energy being low. Okay, concentration. Now, concentration could be not like the kids with ADHD, because I could talk about that all day. But the concentration that people have with ADHD, with depression, may be like people will say, I was just driving along and I had gone 5 blocks and I missed my turn. Okay, or I left my child at school because my mind was on getting to the hospital to see my mama, or I was watching a TV show and I never went to sleep, but by the end of it, I had not even noticed anything that had happened in the show. 30 minutes has passed, an hour has passed. My concentration is off. Or I'm having a conversation with someone and they say, hey, and you're like, I'm sorry, I was just thinking about something. All of those are signs that your concentration is not where it should be. And so if we've got these other things in line, then we're getting a little bit more concerned. Okay? Appetite. There are 2 things that people can do with their appetite. A lot of times people who have depression or sadness, they lose their appetite. Okay? They have no interest in eating. It doesn't smell right. It doesn't look right. It doesn't taste right. It's just not appetizing at all. And so people will lose weight, right? So people go through the breakup diet. We've heard people talk about you lost him and his weight that he weighed, but you also lost a lot of weight yourself. You just sick and can't get going. Some other people, though, will do what some people call emotional eating. They just sit with the big tub of ice cream and just go for it over and over and over again. Either of those are concerning, whether your appetite is gone. Some people will even say, I have no appetite, but they gain weight. And how is that? Because they really don't have an appetite, but either someone is bringing them food and making them eat, or they're going for the ice cream. And so they may only eat ice cream 3 or 4 or 6 or 12 or 20 times a day, but it doesn't seem like they're sitting down to those nice meals because they aren't getting hungry, but they're eating things that are high in caloric content. Ice cream, French fries. My thing is French fries. And nothing beats a slush from Sonic when all else fails. But that's just me. Everyone else has their own things that they like. Okay, so we've got interest, we've got guilt, hopelessness, and worthlessness, energy, concentration, appetite, and then we have psychomotor agitation, which is just the feeling of jitteriness, anxieties. That's agitation. So psychomotor, meaning that you feel the need to move. You feel the need to move. Psychomotor agitation, I'm just a nervous wreck, okay? And so that may be why a lot of people say I'm anxious, but in fact, when we dig down into it, it's not anxiety at the core, it's actually depression. But you're still correct, because anxiety and depression tend to run neck and neck. So you have that, my Auntie Pam used to say, nervous energy. All right, so you feel that agitation and that need to move. Some people get psychomotor retardation, which means, again, that energy is low and that just the Eeyore, woe is me, can't get going. All right, so either of those. And then the last thing is either suicidal thoughts or thoughts of death or dying. And I want to just clarify right here. There is a difference between wanting to die and wanting to suicide. If I say I'd just be okay if I didn't wake up, I may not necessarily hospitalize that person. I need to know what else is going on. You know, some people will say my knees and my back and my neck and my head, they hurt me so bad that if the good Lord just took me away so I could be with him and walk on the perilous streets of heaven and be renewed and have new joints, I'd be all right with that. That person doesn't necessarily need to be in the hospital. But if a person tells me, yeah, my family keeps an eye on me, and the next chance I get, I'm going to jump out of a moving vehicle, well, that is something that we need to talk about and we need to consider and take a little bit more seriously. So hopefully you know those differences, you know the criteria. There's just a few more things about the criteria. I do want to make sure you understand there's a difference between a passive thought of death, which is I'm okay with dying. And you'll hear that a lot of times, that people who've been sick a very long time, people who have been battling cancer a long time, I have heard that people just get tired. The treatment is tiring, exhausting, it's painful. And so sometimes people just are like, Lord, I'm not going to do anything to hurt myself, but if you took me, I'm ready. I just want this to be over. Versus people who are actively having a plan. I'm going to wait to, or they write out a letter. Even letters, though, I mean, I've got to read it and see what's in it and put all this other stuff together, because letters can sometimes be a cue that someone just needs some help. They need some treatment. They need somebody to pay them attention. So please, 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 whenever somebody comes to you and say, I want to die, do not take that lightly. Do not call me at home either, because there is no medicine that I have that's going to magically fix that. This person may need to go into the hospital, and that's okay, right? Because the whole point of me doing this and spending my Fridays with you is to let you know that it is okay to check up on our mental illness. And so I want us to just reframe our whole way of thinking. It's not like, girl, she in the hospital up there at Princeton on the 6th floor. I don't want us to do that. Just say she's in the hospital. You don't have to tell people what she's in the hospital for. Just say she's in the hospital. Because to be honest, if it were not for the grace of God and some of us the good medicine that we're on, some of us would have been in the hospital too. Hello, you ain't gotta like it. You ain't gotta love it. You can just nod your head because nobody can see you. But that is the truth, all right? There is something that is keeping us from being in the position that she or he was not long ago, all right? Hello, Miss Ada. Hello, Shateria. Thank you all for joining. Cousin Charlene, thank you all for joining so much. Please share with others and tell them how much we are learning over here. Now, to get a diagnosis of depression, in addition to the things that I've already said, those are called the criteria, you must have symptoms consistently for 2 weeks, okay? So I am not likely to have someone to come into me. Hello, Sarah Irma. Thank you for joining me. I'm not likely to have someone to come into me with 1 week of symptoms and I say, oh my goodness, this is not good. But if you come into me and I've never seen you before, and you, let's say your husband died and y'all have been married 78 years, and so that would mean you're 100. And yes, old people get depressed too, okay? Babies get depressed, old people get depressed, everybody can get depressed, right? And so you can imagine that if you've spent 78 years with somebody and you're 100, you married them when you were 12. So you've been with them longer than you've been with anybody else, okay, on the earth that's still living. So if you're telling me about a plan, then we may need to escalate the treatment a little bit more quickly, because yes, old people get depressed and old people suicide as well. So please take it seriously. Hey, Auntie Gail, thanks for joining. So take it seriously. All right, 2 weeks, uninterrupted symptoms, being down, low energy, can't get going, not doing the things that you used to enjoy, whatever that is. Blaming yourself, having guilt, feeling low in energy, like your limbs feel like lead, eating too much, eating too little, gaining weight, losing weight, sleep. I forgot sleep. Let me tell you about sleep. If anybody comes in and they tell me I wake up at 2 or 3 in the morning, if they come in with a chief complaint is the problem, the chief problem. Why do they come in? That's what we call it. And if they come in and they say, my only problem is that I can't sleep, and I take a sleep history and they wake up every day at 2 or 3, the first thing that I want to know is all these other symptoms, because those are depressed hours, okay? Those are either depressed or anxious hours. What else is going on that's got you up at 2 in the morning? Now, if you wake up and you go back to sleep, I'm not concerned. You wake up, you go to the bathroom, or you wake up, you heard a loud noise, you got startled, I'm not concerned. But if you wake up at 2 or 3 in the morning, you keep doing that and you can't go back to sleep, I'm thinking about depression before I start thinking about anything else. All right, 2 weeks of these symptoms uninterrupted, and then we need to start talking about what's the next plan. Now, some people will talk about grief, right? So if a person has had a death or a loss, because loss of employment now during COVID, loss of normalcy. Some people just like to get out and be out and about. So loss of employment, loss of friendships, loss of anything. If you have lost something and then you have these symptoms, and you meet these symptoms for 2 weeks, then we're going to be talking about depression. Now, if you want to use the G word over the D word or the S word, then I'll let you do that, but you're depressed, okay? Should you be sad when you have lost? You absolutely should, all right? But if your girlfriend comes by and says, girl, come on, let's go to the mall, and this is post-COVID, girl, come on, go to the mall. If she consistently comes by for 2 weeks and I never want to leave to go to the mall with her, she better call somebody, because I'm not right. I want to get to the mall. All right? And you need those friends to check on you and to do those things. All right. Hi, Sheila. Thanks for joining. All right. So we've got the criteria. Now let's talk about treatment. Depression is treatable, right? Depression is treatable. I want you to hear me loud and clear that depression is treatable. And it depends on how significant your depression is, how we start to treat it. Now, therapy is always going to be gold standard, and it can be first line. Hi, Cousin Cornelia, coming to us from the Eastern time zone. Thank you for watching. So depression is treatable. Therapy is good. And this year has really opened my eyes to the fact that everybody needs therapy. Everybody needs therapy. Everybody. Yep, you too. Everybody needs therapy. And guess what? It's okay. We go to our doctors and get good checkups. My boys went to the dentist today, got good checkups. If you have a heart condition, you go to your cardiologist. If you're a child, you go to your pediatrician. If you have joint pain, you go to your orthopedic doctor. If you have neurologic symptoms, seizures, you go to your neurologist. Everybody's getting checkups. It's okay to check in and check up with someone. And there are some other people, so at baseline, everybody needs therapy. But then there are some other people that escalate it. If you have chronic pain, chronic medical issues, go talk to somebody, okay? If you have kids with any special needs, whether they be medical, mental, academic, or educational, go talk to somebody. Because what I'm finding is that those parents try to use that time when they're in with their kid to talk to me. And that's not appropriate, because that's not what we're there for. I don't mind talking to them, and I must talk with them to get a history, but I'm not there to be their therapist. You need someone devoted to listen to you and to do nothing else. When parents come to me, they don't want me to be on the phone with my husband, because they are paying me for that time to listen to them and talk to their kids. Thank you, Cousin Cornelia, for sharing. They may need it, they may not. You're right, and that will be up to them. But I'm here, and I'm loving this open communication that we have, because people can watch and I don't even know they're watching, and they can be taking notes and I don't even know that either. So this is literally free and available for anybody who needs it. So thank you. All right. So it's I'm gonna get off my soapbox now about therapy, but go get you some. Sign up. I can give you resources about. I have several friends who are excellent in the Birmingham area, but I am in several groups of other like-minded professionals. So no matter where you are, I can have you an answer in a matter of 24 hours about somebody in your area to help you with what you need as far as therapy or medications or whatever else you may be looking for. All right. Therapy is an option. Medications. Okay. Now, there are several different classes when we talk about treatment of depression. Okay. We've got medications that increase serotonin. Those are going to be medicines like Prozac, Zoloft, Celexa, Lexapro, Paxil. Some of y'all have been on those medicines, and it's okay. We can't see you. So I'm just glad. Just keep taking them if you're taking them. All right. If they are working, keep taking them. If they're not working, go back and say these aren't working, because you can be healthy and free from depression. All right. We've also got other medicines that work on both serotonin and norepinephrine. These are going to be your medicines like Cymbalta and Effexor. Okay. And some people say, I don't take it for my depression. I take it for my nerves. Wink, wink. I don't care what you're taking it for. If it's helping you with your mood, keep on taking it for your nerves, okay? Your fingers, your joint, your neck, keep taking it because it's working on both. And if that's what you need to do to feel about life, I obviously want you to claim it and say, I'm sad. But if you're not there yet, keep taking the medicine for your nerves until you get to the point where you can verbalize, I'm sad. And that's okay, because we tiptoe every day. There's a thin line between being okay mentally well, and not. And we go back and forth all day. And some of us just dip over and stay a little bit longer than others. But we're there all day, every day. We go back and forth, okay? So you got your medicines, you've got therapy. Then you got things like ECT. When your medicines are not working, you've been on several different medicines and several different classes, and your medicines are not working. There are some other medicines that I did not mention. Sometimes we will do Remeron, which is one that will help with sleep and appetite and depression. So we use that a lot in the elderly population who, of course, lose their appetite anyway, just as a part of aging, and they can't sleep as a natural part of aging. That's just what happens as you age. And then there are some others, but your medications that increase serotonin are definitely going to be the ones that we usually will start with. A word about serotonin. Serotonin can be found over the counter. And so people will call me because they don't want to be on these medicines, right? But they'll call me and they'll say, girl, I was in Walmart and I picked up some serotonin. Or I picked up some St. John's warts or something. You need to know that these medicines over the counter can interfere with your cholesterol medicines. They can interfere with other psychiatric medicines. They can interfere with all sorts of medicines. So before you go picking up stuff over the counter, treating your depression or your sadness or your grief at home without someone knowing, make sure that they are not interfering with your other medications, even your birth control pills, right? You don't want to end up pregnant thinking you're not hurting anything because it's over the counter, because certainly things over the counter can interfere with other medications, and it can either make it so that those medications are at levels that are higher than your doctor thinks they are, or at levels lower than your doctor thinks they are. And if they're lower, like with the case of birth control pills, then you get a surprise. All right, which may further make you depressed. So it's so much easier to just go see a professional and get it treated than to end up with a baby. In this particular example that you're like, oh my goodness, I did not know that this was happening. All right. So you got therapy, you got medication, and then you got ECT. Now, ECT has been around forever. It is considered one of the gold standards for refractory, meaning it won't get better. Stubborn depression, ECT, okay? It is not anything like what you've seen in the movies. In case it is, in fact, it's nothing like it. You go there may be a little jerking of some limbs, but there is no foaming of the mouth. There is no eyes rolling up in the head. There is no flopping and flailing on the table. It's very anticlimactic, as I like to call it, which means that it's like, oh, that was it? But ECT can have some cognitive problems, some memory loss that a lot of times people don't get back. And so, of course, so if you're already forgetful, not concentrating, just down on life, don't want to go to the mall, don't want to knit, don't want to be around your family, and you've always been the life of the party, then having a little bit of, and I mean, it's just a little bit of memory loss is worth it. Now, something that is a little bit newer is called TMS. transcranial magnetic stimulation. And the reason that I am dressed this way is because I actually do that. So y'all know I have to do a lot of different stuff. But we call it the chair where I work. And so TMS is where patients will go in for 5 days a week for 4 to 6 weeks. And you will have something like that is very similar to the waves that people get when they have an MRI. All right. So you go there, you spend about 20 minutes in the chair. It's a very calming situation. It's painless. The biggest side effects that some people may notice is that for the first week or so, there's some tenderness in the scalp. The probe is about that big, and it just sits on the top of your head. It just sits right there. It's actually closer to about right there. It sits there, and we basically give you pulses in the area of the brain that we know is related to mood, okay? And we get these pulses for 20 minutes, like I said, a day for 4 to 6 weeks with a taper at the end. What has been found is that people are being depression-free for as much as 1 year. 85%. Now, let's think about who the people are that are going to get TMS. These are people who have been on all the medicines that I've named, plus some more. They've tried things in combination. They've prayed. They've done therapy. Most of them have not done ECT usually because they're holding off on ECT because they don't want the memory problems. But they've tried everything. In fact, in order for your insurance to cover it, there is a requirement based on your insurance that you failed 2, 3, or 4 medications before even being someone who would be approved for the chair for TMS. So 85% of people who are having it are either have symptoms that they can go about life. They can go to the mall. They can get up and go. They may still not sleep at night, but they're going about things, and life is becoming more normal again. And they do that for a year, and some people may have to come back. And so some people may say 85% for a year. But if you think about it, the people who are coming in for TMS have been depressed for so many years that they forgot what it is like to not be depressed. So a year of being depression free is like a lifetime for that person. All right. So we have to make sure we put things in perspective. At the place where I do it, and I'm all like this because I have goggles on and everything because it's COVID. All right. And I just decided that I would talk about depression today because I knew I was going to do this. And so I knew I wouldn't have time to change. And so I thought, well, we'll just talk about why I'm dressed this way. And so I protect myself from head to toe. Double mask, goggles, hair is up. And thank you to Miss Ishii for my hair and my face mask, which matches. But it works. It works. After about the 3rd week, we have people to complete a survey every week, so at the beginning and every week, for what's called a PHQ-9, which looks at your depressive symptoms. And so at the beginning of the treatment, people's scores are very high and into the high teens and 20s. And by the time they finish treatment, they're at 3s, which means that it has worked for their depression. And you start to notice improvement in your mood at about week 3. So we've even had some at week 3 who they didn't notice it, but their spouses were like, oh yeah, it is working. They're no longer irritable. They are sleeping better. When the grandkids come over, they actually throw them up in the air and catch them, opposed to saying, I'm going to my room, them kids coming over. So all of these are things that are life-changing for people. And so that's just one thing for you to consider. Like I said, there just is some tenderness on the scalp. Some people get headaches for the first week or so, and then it goes away. The intensity of the machine is about like a woodpecker pecking. Nobody probably knows what that feels like, but if you ever heard the machine and you can imagine what that is probably what it feels like. And it goes away after about the first week. So a very viable option for people who have depression that is just stubborn and will not go away. Now, we've talked about what depression is. We've talked about how we treat it. The last thing I want to talk about is depression has different looks. Now, the other reason that I wanted to bring in the TMS treatment is because even for me as a psychiatrist, I was very shocked. I was very shocked when I first started treating patients with TMS, because some of them would come in and they would be like, hello, Dr. Bowling. And I'm like, is this the right patient? This patient is coming in and they failed everything under the sun, right? So the saying, check on your strong friends, is very true. Sometimes your strong friends are putting on a front, and they need to be checked on. Sometimes your psychiatrist friends need to be checked on. Your mommy friends need to be checked on. Everybody needs to be checked on. And sometimes we just need to ask the very blunt question, how are you doing? And when they say, girl, I'm fine, you need to say, no. How are you really doing? You need to be the friend that asks them, are you okay? What can I do to help you? And then if they say, girl, I just don't know, I can't get going, then you need to figure out a way to help them. And if that's with me, just shoot me a message and say, hey, I've got a friend. They need some help getting going. Who can you send me to? And I'm going to pull out my list and I'm going to get you going. But that is very important to know. Depression looks very different in very different people. It's not what you see in the movies. It's not the person who's in bed and is not going to work. I have treated, doing TMS, people who were high level up at their companies. I have treated professional folks, dentists and doctors, who I never would have imagined, just based on my interaction with them. You read their chart, that's one thing, but then when you meet them and they're like, hi, and then they start to tell you all the things they've gone through, and you're like, oh my goodness. Depression really does have a lot of different faces. So please do not make the assumption that because a person looks a certain way, that because a person has a certain job, or that because a person has the life of that you would want. Don't be so quick to assume that they're okay, and certainly don't be so quick to wish that you had the things that they have. Just as I was driving home from TMS today, I read an article where Tamar Braxton, and I'm not sharing her business because it was in the news. I'm not treating her. I saw this in the news like many of you may have. So Tamar Braxton is Tony Braxton's sister of the Braxton sisters, and she's got this and that and this and that, and she divorced and she had a kid and blah, blah, blah. And she overdosed, okay? Her boyfriend called 911 to say that she had taken several pills and had drank some alcohol. And who would have thought? She's got a new upcoming show. She's got the new love of her life. But there were some things that weren't right that we didn't know about the show. So you just never know. You're never too rich. You're never too famous. There is absolutely no color associated with this. So please stop. Black people suicide, white people suicide. Anybody can suicide. Anybody can be walking around depressed, and they could just be but one thing away from going over to the other side and not coming back. All right. Let's see. Thank you, Kathy, for joining us. Auntie Gail says, is road rage normal? And I would say no. Road rage is not normal. Anybody that again fits into that irritability. People speak and you growl back at them. Road rage kind of fits into that irritable. Why in the world would a person be that irritable? Now, sometimes you're just running late, and maybe that's what you do when you're running late. So I would advise that person to, get a calendar, get a timer, try to get up a little bit earlier, whatever else. But no, road rage is not normal, and there's something else going on. And we must remember that people die from road rage, get out of their cars, shoot, all this kind of stuff. So that is not normal. So Irma says, say it, because a lot of our folks are depressed, and we are. And we need to say it. Like we say their names. We need to say, I'm depressed, I'm sad. It's okay. That's the only way you're going to get some help. Depression, and stop telling people to just snap out of it. If they could snap out of it, they would have already. And so that's really offensive to someone. That's like telling somebody with diabetes, just don't have it anymore. When was the last time you told somebody with diabetes to just not have it? You may encourage them to eat better. You may encourage them to take their insulin. You may encourage them to not eat sweets. But you don't tell them to snap out of diabetes. Likewise, do you not tell them to snap out of high blood pressure, to snap out of cancer, to snap out of strokes. You just don't do that. You encourage them. You're there for them. You call and you Google. And Google is okay, as long as you are not associating everything that's happening in life with something you found on Google. That just may not be the case. All right. Okay, let's see. Uh-oh, I did it again, y'all. I'm sorry. It's 12:46. Let me get out of here. If you have any other comments, please drop them. Thank you all so much for joining me. Please share this information. Somebody you know needs it. You may not, but somebody you know may need it. Just to summarize one last time, for the people in the back or the people that just came, depression is real. We know it because we have either, or someone else, either has low mood or irritability. Auntie Patrice says, is there functional depression? Absolutely. So these are the people that are still going to work, they're functioning. So that's not a term that we use clinically, but that is what the people are that are coming in for to get TMS. Like, I would never, if I saw these people on the street, I would never know that they were so depressed that they had failed 6 medications, because they were still going to work and they were still getting things done and they were still taking care of their kids. And late at night, when they put the kids to bed, when they turned off the computer, they cry themselves to sleep and then they wake up at 2 or 3. They're functioning, but that's not normal. So functioning does not equal normal. Kind of like if you think about the functioning alcoholic. The key is alcoholic, not functioning. That person needs help. That is not healthy to be an alcoholic, even if you can drive and not get in a DUI and kill anybody. That's not okay. All right. So thank you for that question. That was a great one. And thank you for the compliment, Mommy and Sarah Irma. I'm glad that you are enjoying these Fridays, and that is why I'm doing it. Please tell others about these Fridays so that they can join us and get some information too. So depression is real. You either can be irritable or sad or depressed, plus have low energy, low interest in the things that you would normally do, poor sleep, have thoughts of death, have feelings of guilt, feelings of hopelessness, feelings of worthlessness, poor concentration, and just not be able to go about life. You need these symptoms for 2 weeks. And then we can treat it. That's the second thing. We can treat it. We can treat it either with therapy and or medication, or we can treat it with other things like transcranial magnetic stimulation, which is a fabulous treatment, and insurances, even Medicaid and Medicare, are covering. I will tell you, though, that 20 minutes every day, 5 days a week is a lot. So if you don't have one of these centers that is doing it close by, that can be a big time commitment, and you're probably going to need to, take some time off for your job, because if you think 20 minutes to travel, 20 minutes to get back to work, and then 20 minutes for the treatment, that's your lunch. But it is so worth it. You got to do some things for yourself. All right. And then, of course, we have ECT. And then the last thing is that I want us to immediately today just work on our negative connotations of mental illness in general. Try not to speak negatively against those people who have mental illness. Let's start to change the narrative. These are all phrases that we hear, and they're applied to all sorts of other things. But I want to encourage us to apply these same phrases to mental wellness, right? Stop telling people they need to just get over it. If they could, they would. Just like if you would have, you would have. Some of us that are telling people to get over it, we're battling our own demons. And demons don't have to be drugs. Demons don't have to be casino. Demons of depression, demons of anxiety, demons of lying. All of those are demons. And so we do need to pray. When church opens, I'm going to be the first one to go, and it's safe. Okay. Pastor Young, I'm not ready there. But I still pray. I still do my thing. But there's nothing that says that you can't pray and go to your therapist, or pray and go to your psychiatrist. All right. Okay, folks. Sorry I took y'all so long to get to this point, but I want y'all to be careful out there. Coronavirus is real. All right. And this is my medical hat. Coronavirus is real. A month or two ago, I knew of only famous people with it. And then, it kind of closed into maybe one person I knew with it who died. And now I can probably very easily come up with 5 people who I would probably have come in contact with in the next month just by walking by. It's real. Be careful out there in these big groups. Wear your masks. It's a state order here in Alabama, but make sure that you don't need anyone else to tell you what you need to do for you, which is of course what I'm doing in that backwards. But sometimes we need to be reminded. But make sure you're wearing your mask. Make sure you're washing your hands. Make sure you're protecting yourself, because if you don't protect yourself, there is no one else on this world that will. I love y'all. I thank you all for being here with me. Thank you all for your compliments. Go ahead and show me some love. It takes a lot for me to get on here, and I actually put a lot into thinking about what I'm going to say to you. And I hate to sound like I'm preaching to you all, because you're here and so you're getting all this information. But I am so passionate about what I do. And it's almost so painful. It almost hurts when I see people who could feel better, right? They could feel better. It's like a person with a fever saying I'm hot, but not taking Tylenol. That just hurts me to my core. It just hurts. So I want y'all to feel better. I want y'all to do better. And I want you all to start telling your friends that they can feel better and do better as well. Again, I love y'all. I'm Dr. Brandi B, your triple boarded child and adolescent psychiatrist. I help worried, overworked, overwhelmed, and plain old tired moms, dads, grandmas, granddads, and everybody become educated so that they can feel better about taking control of their mental health issues, and empowering and encouraging those people who are with them and around them and in their families and friend circle to know that they can feel better and do better too. I want nothing but the best for you all, and I will look forward to seeing you all next week. I've literally grabbed these topics up throughout the week, so if there's something that's on your heart, just shoot me a message and say, Dr. Brandi B, can we talk about this? And I'm going to try my best to make that happen for you all. Y'all have a great weekend and be safe. Talk to you later. Bye.